to you.
Thanks. Yay, full screen. Hi guys, my name is Kristina and thank you so much for having me tonight because I am going to speak about something that is very important to me, something that I have been through, and I'm going to talk less about me, but more about the education that has changed my life and that, in my opinion, every single person should know about. And it's very helpful to humanity. Before I start, I would like to ask you a question about mental health. What comes to your mind when you think about mental health? And what experiences have you had with it?
Depression. Dementia.
With, I worked in drug and alcohol, so there was often a dual diagnosis. So the experience, I guess my worst experience with it was walking somebody around the emergency department who was having an episode, and he was a past Colombian drug dealer, huge guy.
He was in
and he was
trouble.
very angry, so I was there to calm him down. It was quite, you could see him growing in agitation, and in the end they had to tackle him and knock him out, but, not knock him out, but give him an injection to calm him down. So yes, it can be very frightening, not just for the person, but people around.
So you,
An enviable task, Margaret.
so you struggled with mental health because of alcohol and drugs?
No, I
Or-
worked in a...
Oh, you worked, okay.
Yeah, in a drug and alcohol rehabilitation centre. So there was a lot of people there with the dual diagnosis, addiction and mental health. It was quite common. So they would use drugs to medicate.
Yeah, that sounds very severe.
Yes.
Okay. So what I have experienced is, for me, I never had to reach out to a real mental health professional. I was able to, through my own research and self-help, find the solutions for myself. But I have experienced and saw a lot of my friends receive mental health support that was not helpful or even harmful to them. And that's why I created a little basic information for everyone that if they want to go into mental health help, they can identify what the right help is or if the therapist is not right for them. And yeah, so through proper education and human connection, I want to make it a less intimidating and scary topic. Yeah, I want to spread awareness, like I said, about how harmful, outdated and incomplete, especially, mental health support can be, and have some little fun ideas about how to shift the paradigm of mental health. I want to start with the two parts that we all have within us that makes us human. And the first one is the part that you control. It's pretty simple. And yeah, this is the thoughts and emotions and behavior that we consciously choose. And the second part is the part that we don't control, the part that is scary to many, that many don't understand. And emotions, automatic emotions, behavior, can you see? And the parts that we can't control that are automatic, like automatic thoughts, behavior, emotions, is what confuses most people. And also, we have the same part controls our basic body functions, like breathing and heart rate and digestion. Yeah. And here we come to the two main types of therapy. The first one is called top-down approach, which is cognitive behavioral therapy. I don't know if you have heard of it or have experiences with that therapy. But that therapy, like the name says, you work on your behavior by changing your thoughts. And you try to change how you feel by changing your thoughts. But this is actually ineffective for people who are overwhelmed emotionally because they cannot access their higher brain, which I will also explain in a second. So, how our brain works. The higher brain, where we have our cognitive functions that allows us to think, to remember, to invent, to decision make, be creative. This top part of our brain, when we get overwhelmed, is not accessible. And then we have the lower part of our brain, which when it gets activated, and our top brain becomes inaccessible. So our lower brain directs all our instincts and is very fast because it also is evolutionarily older than our higher brain. And that's where our automatic responses come from. So when we're overwhelmed, we actually cannot think properly. And that's why cognitive behavioral therapy is not as useful. Now, when we feel overwhelmed, we don't feel safe. So our body shuts down our top brain and this is actually really, really simple. So it shuts down our cognitive functions. And that's why I'm also stuttering right now, because it's my first speech. Cognitive behavioral therapy does, and it's really useful to be aware of it. It makes people overwrite their experience that they have in their body. And that's why it's actually not a sustainable therapy. It works for people who can access their higher brain, but it's less effective for people who cannot. So people who try to change how they feel, they feel forced. Like they tell themselves good things, but it feels forced. Like they don't feel in their body like it's true, which has a name for toxic positivity. Positivity can be good if you actually can feel it, and it changes how you feel inside. But if you have to force yourself to think that way, it's less effective. Oh yeah, one thing that I would like for you to take away from the whole speech is there is actually nothing wrong with any one of our thoughts or emotions. All your thoughts and emotions make sense and are there for a reason. So we are working towards removing the shame about them. And depression and anxiety are emotions, and emotions are not disorders. Emotions are normal human responses, and the reason why we are so scared of depression and anxiety is because we don't know about it. So anything that we don't understand, we find scary. And it actually is just some sensations in our body that we don't know how to deal with, that we don't know what to do with, and it feels scary inside. So that's why depression and anxiety themselves are like quite scary words, like they intimidate people. But since I learned about what it actually is, it's not that scary anymore. And yeah, the second time, that's exactly what the second type of therapy is about. It teaches people how to work with their experiences, with their sensations of their body. One modality is called somatic experiencing. And this is way less known. And traditional therapists usually don't know about this approach. So, yeah, the modern school of thought here is that you first work on your bodily sensations, and then your thoughts will change. And learning to understand your body and its signals is like learning a new language. It takes time. And this is really important. What follows after when traditional or any kind of therapy fails is that the patient feels a lot of shame. They think that there is something wrong with them and not with the method that they go through. Like I said, traditional mental health professionals don't know about the bottom-up approach, and their next solution is prescribing medicine. And I am not against medicine. It's just I have seen a lot of people take medicine for decades. And to me, medicine should be a short-term solution, a short-term help, and not a long-term band-aid. And here we come to identifying unconsciously incompetent professionals because they just don't know what they don't know. First of it is looking at their teaching style. Is it authoritarian or authoritative? So do they boss you around, or does it feel like they are not taking your concerns or questions seriously? And I have heard a lot of bad therapy experience from people. Top-down therapists have a higher chance of being incompetent because they lack the skills of the bottom-up approach. But bottom-up therapists can also be unconsciously incompetent when they have the skills, the techniques, but they're actually not practicing what they're preaching. So they haven't done the work on themselves. And yeah, the easiest way to recognize it, you just don't feel comfortable or safe or understood by the professional. And the second point, a very fun point, shifting the paradigm of how we understand mental health. I have 2 points. First of all, this is controversial, but any new thing is controversial. And a mentor of mine described it. He said that mental health is actually an incorrect term for it. It would be more correct to say it's emotional health. And emotional health is relational health. As a society, we are not recognizing 2 essential human needs, the importance and impact of them. And it's being yourself and having people who love you for being yourself. So having good relationships. And the second idea is the connotation that we have with mental health and physical health. A lot of people, when I tell them about mental health, they start telling me about diagnoses and diseases, illnesses. And when I talk to people about physical health, they come up with their first thought is about exercise. So I want to make mental health more proactive instead of reactive. The normal thing to say is when you're not exercising, no wonder you're sick, because you're not exercising, you're not moving your body. But what we should say is that if you are not being yourself and you don't have safe relationships with people, then we should say, no wonder you're sick. So normalize saying that. Here's a little guideline, the last slide, for how to identify the right help. It's looking for a professional who has education on both approaches, because they're both needed. And to get ideal results, you use both approaches. This is where you have the science of therapy, which is the technicals. You look for someone who has done that work on themselves too, to be able to provide a safer, more stable and space for you. Somebody who can be present, fully present for you. And very simple, but what a lot of people actually oversee is feeling safe with that person. Having the art of therapy, which is the people skills, which is making the person heard and understood. And the keywords, if somebody would be looking for a therapist, would be to look for someone who's trauma-informed. Those are a little bit more complicated terms right now, but I'm not going into them. It's just if anyone wants to do further research or look for somebody who's trauma-informed and polyvagal theory-informed. And the most important part is that your sense of safety, which a lot of the time people don't think about. It's very important to make the person who is on a healing journey feel safe and understood, and work together in a team, because therapy and healing is teamwork, and both parties contribute to it. that's it. Thank you for listening, and thanks for letting me spread the information. Yeah, of course.
Especially on that last slide. I mean, I think you're talking about the professional that you're going to see as a counsellor or psychologist, right? I can't see anyone walking up to a psychologist and asking those questions and him saying, no, I haven't done any work on myself. No, I don't know what you're talking about. They'll all say, just like every doctor, I'm the best surgeon there is, I'm the best dentist there is. How would you know the difference? I mean, those questions cannot possibly be asked of a professional.
I actually had a therapist, and he was a cognitive behavioral therapist. Yes. And I came up to him and I asked him if he knew what the polyvagal theory is. Yes. And he just said no. So this is just an indication that he is educated on the type of therapy that has been used before and for a longer time. Okay. So that's why this is really hard to find, because I had to discover all of this myself. And thank you for the question. And that's why I'm trying to just give people a basic understanding so they are able to find the right support with having the little foundational knowledge like this.
Okay, but because you haven't explained what polyvagal is.
Exactly, yeah. That's why I'm saying those ones, it would take multiple hours to actually explain and go into that. But it's a theory from '94. It has been around less than the other methods. But if you go into the world of that, you will find a completely new world of therapy, which is more compassionate, because it explains to you why you react the way you do. And that's why I love it so much. It just makes sense when you read into it. I know it can be a little bit confusing. That's why I'm like, keywords. If you want to do some further research, this is what to look for.
I just ask, the talk that you've got there is focused on depression and anxiety. And just that? Or I was thinking about other conditions like...
Yeah, more depression, anxiety, but really if you read into it, there are so many things that you can actually improve by learning this. Yeah?
Mental health can be brought about by a number of different reasons. For instance, it's not uncommon for many women to suffer postnatal stress disorder.
What did you say?
Postnatals, postnatal depression.
Yes, it's not uncommon for lots of women to suffer because of postnatal stress disorder, is it? But
Did you know men suffer it too? Men suffer that as well.
Do they? Yeah, I didn't realise that.
And that's why the bottom-up approach, it explains you to understand your body. And this can be helpful, what they are going through, to understand why the thoughts and emotions or bodily sensations are coming up within them. So that's why I love it so much. Okay. The bottom-up approach.
Good.
Did that answer your question?
Yes.
Thanks.
Are there any other questions for Kristina?
Yeah. With the mental health, you talked about depression, anxiety, and most of those, and I suppose you've got schizophrenia, you've got trauma. Most of those symptoms are actually not cured, but stabilised by some form of tablets or injections or drugs. What are you actually saying there? Is that there's a different approach to the medical side of it?
So it's one step before the medication. It's another step that people don't know about that is not invasive, that people can try. And if that doesn't work, then they go further and try the medication. Because they can also do the work while on medication, because it allows them to focus on it and do this work. So it really depends how severe it is.
Right. But one doesn't know if they've got a mental illness until such time as it happens. So therefore, you wouldn't necessarily know to do those little steps or exercises. I'm talking from experience, because I do have a son that suffers from mental illness, but he's a psychotic situation, I don't know how it happened, but it happened. He was an adult when it actually happened. And his world is not true. But he's had all sorts of different therapy, and he's had all sorts of different tablets. And the only thing that's worked for him now, which is, thank God, he's stabilised. He actually has an injection now every 2 weeks. And he's now stabilised. But I've actually found that people in his situation is that they think they're okay. Nothing wrong with them.
Exactly.
You know?
Exactly.
No, I'm okay.
Yeah.
You're mad. I'm good.
Yeah.
So it's a difficult situation.
Yeah, that's more severe cases, and I don't go that far because that's where my expertise stops. I don't go as far as where people take medication. I help people before that. But I still recommend, I can still recommend to look into the education of understanding your body, because a lot of the things that people do is on autopilot. So to understand the autopilot and why a person is doing what they're doing.
I think if you're stable, you can actually control that emotion. You can control those decisions.
Yeah.
So,
If you're stable, you can access your higher brain, and then you can learn, because learning is a cognitive task.
yeah. Okay, thanks.
Of course.
Any other questions for Kristina?
Say a person's got bipolar disorder and they're on medication for a long time. How might you suggest they change and get off that medication?
Like I said, the area of medication is not my expertise.
So you suggest they use this polyvagal theory?
I suggest to find someone who is informed in that, because they would know in a more holistic and more sustainable way how to even deal with medication. If you find someone who actually says that they know about medication.
So
But
are there psychiatrists that are trained in that method?
yeah, absolutely. It's like different little worlds of therapists. And when you go into that world, you can find different practitioners that are trained in it.
Sure, thank you.
Any other?
I like the many questions.
Is there a professor that actually produced this theory, or somebody?
Yes.
Scientist?
Yes, it's neuroscience.
Who is it?
It's Stephen Porges.
Stephen Porges.
Yes. He is from the US somewhere. Yeah.
Google that will probably give you.
Please, yeah. He is, I think he's even a psychiatrist. He also is a neuroscientist and has studied biology. So, yeah, he's cool. I want to meet him.
He's your idol.
Yes. Like, people have like actors as idols. I have professors as idols.
Any other questions? I wonder if everyone could join me in thanking Kristina.
Yes.
Thank you.
Thank you for that, Kristina. Thank you very much for that. And visiting our club. I think I'm more confused. Don't run away.
Sure.
It's okay. You don't like my perfume? Okay. I'm more confused than I was before. But one question. I think, not that I've ever been to a counsellor, but I would imagine from what I see in the movies and what I hear people like you talking about them, isn't it a matter of you getting along with the person as in any relationship?
100%.
And you wouldn't know that until you actually went for a couple of visits or whatever.
Yeah.
So if you kept on changing, it would be a pretty costly affair, wouldn't it? You kept on changing counsellors because you've got to try them. You know, I mean, they can say anything when you ask them, but you've got to try them.
You got to try
right?
anything in life to know how it
Yes.
is.
And do psychiatrists also counsel, or do they just say, here, take this for the next 20 years? Do they actually counsel? Do you know, psychiatrists?
I think, yeah, it's so individual, and every professional is practitioner is different.
Yeah. They've all got their own system, I guess.
Yeah. Also, the knowledge that they take in and use is so individual. Also,
Absolutely.
That's why I just described the two main parts,
Yes.
and the way that they use and
Yes.
the way they help people.
It's just like in every subject, unless you know something about it, you don't have the right questions, right? You only have the right questions after you start understanding, right? Well, thank you very much. With our club would like to perhaps offer you these to see what Rotary does and our many avenues of service, and a little pen from us. So
Thanks.
whether when you write your next thesis, you can remember us. Thank you
Thank
very much
you.
for coming.